The job description of a medical technician centers on supporting physicians and laboratory technologists by performing diagnostic tests, preparing specimens, and ensuring accurate results that inform patient treatment. Medical technicians are an integral part of healthcare teams in hospitals, clinics, laboratories, and diagnostic centers. They handle various technical tasks that are critical to diagnosing diseases, monitoring patient health, and facilitating treatment plans. Medical technicians work behind the scenes but have a direct impact on patient outcomes. By processing biological samples and conducting tests, they provide essential data that doctors rely on to make informed decisions. Their work spans multiple specialties, including hematology, microbiology, immunology, and clinical chemistry. Given the nature of their duties, precision and attention to detail are indispensable. Most medical technician positions require formal training and certification. Whether employed in emergency care settings or outpatient labs, these professionals must adhere to strict safety protocols and maintain high standards of hygiene and accuracy. Their role requires a deep understanding of laboratory procedures, strong technical acumen, and the ability to work both independently and collaboratively. Primary responsibilities of a medical technician. Medical technicians perform a variety of tasks under the supervision of medical technologists or laboratory managers. A key responsibility is collecting and preparing biological specimens such as blood, urine, tissue, or other bodily fluids. Proper specimen collection is crucial, as even minor errors can compromise test accuracy and patient care. Once samples are collected, medical technicians use laboratory equipment to run tests. These tests might include blood counts, cholesterol levels, or microbial cultures. Technicians must operate machines such as centrifuges, analyzers, and microscopes. They must follow established protocols and quality control procedures to ensure consistency and reliability. Recording and interpreting test results is another essential function. Technicians input data into laboratory information systems, label and store samples correctly, and flag abnormal results for further analysis. Although they do not make diagnostic decisions, their findings are critical to identifying health issues. Maintaining and calibrating laboratory equipment is also part of the role. Technicians perform routine maintenance, troubleshoot malfunctions, and notify supervisors of any technical problems. Cleanliness and organization are paramount in a laboratory setting, and medical technicians are often tasked with sanitizing workspaces and managing chemical or biohazardous waste. In many healthcare facilities, medical technicians are also responsible for inventory management. They ensure that testing supplies, reagents, and consumables are stocked and within expiration dates. This logistical aspect of the job helps maintain the smooth operation of laboratory functions. Communication is vital. Technicians must liaise with doctors, nurses, and fellow lab personnel to coordinate tests and clarify sample requirements. In smaller facilities, they may also engage directly with patients, explaining procedures and ensuring comfort during specimen collection. Midway through understanding their key duties, it's essential to highlight that the job description of a medical technician encompasses not only laboratory precision but also interpersonal collaboration and logistical coordination. Essential skills and qualities for the role. To be successful as a medical technician, individuals must possess a blend of technical expertise and soft skills. A keen eye for detail is indispensable, as the work involves handling sensitive biological materials and performing precise measurements. Mistakes can result in misdiagnosis or compromised patient care. Technical competence is crucial. Medical technicians must understand laboratory methods, know how to operate diagnostic machines, and keep pace with advancements in medical testing technology. Familiarity with automated systems, electronic health records, and lab software enhances efficiency and accuracy. Critical thinking and problem-solving skills are equally important. If equipment malfunctions or test results seem inconsistent, technicians must analyze the issue, adjust protocols if necessary, and consult with supervisors to resolve the problem. Good organizational skills support task management and documentation. Medical technicians must keep accurate records of tests performed, materials used, and results obtained. These logs are not only used for quality control but also serve legal and clinical auditing purposes. Strong communication and teamwork are also vital. Medical technicians often collaborate with healthcare professionals to coordinate test schedules, clarify test requisites, or discuss abnormal findings. Their ability to articulate technical details clearly and professionally enhances collaboration and improves overall patient care. Integrity and confidentiality are non-negotiable. As custodians of sensitive medical information, Technicians must comply with healthcare regulations such as HIPAA and ensure that patient data is kept secure and private at all times. Adaptability is an asset in this role. Technicians must be able to handle changes in workloads, respond to emergencies, and learn new procedures or technologies as required. In fast-paced environments, the ability to stay composed and focused is invaluable. Work environment and challenges. Medical technicians typically work in clinical laboratories, hospitals, diagnostic centers, and sometimes in research settings. Their environment includes sterile, well-ventilated labs equipped with advanced diagnostic machinery. Depending on the setting, they may work during regular business hours or in shifts that cover nights, weekends, and holidays. The job can be physically and mentally demanding. Technicians often stand for extended periods, perform repetitive tasks, and work under pressure to deliver quick and accurate results. The need to meet tight deadlines while maintaining high quality can contribute to occupational stress. Exposure to biohazardous materials, chemicals, and infectious diseases is a risk. Therefore, adherence to strict safety guidelines and the use of personal protective equipment, PPE, are mandatory. Medical technicians receive thorough training in handling potentially dangerous substances and are expected to follow all institutional and regulatory protocols. Despite these challenges, many medical technicians find their work rewarding. They play a crucial role in the diagnostic process and have the satisfaction of knowing their efforts contribute directly to patient recovery and well-being. Moreover, the job offers opportunities for continuous learning and advancement. Depending on the organization and location, compensation may vary. Medical technicians may receive benefits such as health insurance, retirement plans, and allowances for continuing education. With experience, they can advance to roles such as laboratory technologists, lab managers, or specialized technicians in cytology, histology, or molecular diagnostics. Educational requirements and training. The job description of a medical technician typically requires candidates to have an associate degree in medical laboratory technology or a related field. Some employers may accept candidates with a certificate from an accredited medical technology program, especially if they have relevant experience. In many regions, medical technicians must be licensed or certified to practice. Certification from recognized bodies such as the American Medical Technologists, AMT, or the American Society for Clinical Pathology, ASCP, is often required. Certification demonstrates a candidate's competence, enhances job prospects, and may be a prerequisite for higher-level responsibilities. Training programs cover subjects such as anatomy, physiology, microbiology, chemistry, and laboratory mathematics. Students also receive hands-on instruction in sample collection, laboratory techniques, equipment use, and quality assurance. Clinical internships are a vital component of training, providing real-world experience under professional supervision. Continuing education is important in this dynamic field. Technological advancements and updated testing protocols require medical technicians to stay informed and continually hone their skills. Many certification bodies require technicians to renew their credentials periodically and complete approved educational activities. Conclusion. The job description of a medical technician illustrates a role that is both technically complex and highly impactful. These professionals bridge the gap between patient symptoms and medical diagnosis by ensuring accurate, timely, and reliable laboratory testing. Their work influences treatment plans, supports clinical decisions, and enhances the overall quality of healthcare delivery. For individuals with a strong interest in science, a meticulous nature, and a passion for helping others, the role of a medical technician offers a meaningful and fulfilling career path. As medical science continues to evolve, the demand for skilled technicians remains steady, making it a promising field for aspiring healthcare professionals.